Welcome to Bullshit TV. I'm your host. So just give me a second. I just got off work, but I'm going through, the news, my news feed. You know what I'm saying on Facebook, talking about Yahoo and in MNBC. So I'm trying to get to my lighting here. So just give me a second. What Give me a second. Give me a second. Give me a second. So welcome to Bullshit TV. I'm your host. What's on today's docket? Um. All right, here we go. All right. Welcome to Bullshit TV. I'm your host. So, I'm always here to report the shit. I haven't been watching TV like that. You know what I'm saying? I might put it on, TNT to watch, basketball in live time. You know what I mean? So I have been very steering away from the TV, you know what I'm saying, and been going into research. So that's all I do all day. Research, and I inform y'all information that I can read and understand. But at the same time, I want y'all to be able, I give you little pebbles here and there so y'all can go and look up the shit y'all selves. You know what I'm saying? I just cut the work in half. You know what I'm saying? So you don't have to figure out how to get the wording together, and then how to you know what I'm saying? Just, trying to find what you're looking for. So I have figured cut ways to cut through. So, you know what I'm saying? So I give you the information. If you want to fact check the shit and you want to look deeper into it, just take what I say, use little keywords, put it into the search engine, no matter what search engine you use in Yahoo, Safari, Bing, Bing. I don't know if anybody remember that, but Bing is a search engine. Google, shit like that. So this is basically talking about what's going on with the coverage in Michigan. Basically, the title, I got this notification from Yahoo, but the actual article is on WILX 10. You know what I'm saying? So here it is right here. Right there. Michigan Medicaid users may lose coverage. Officials offers insurance options. Okay. First off, I want to say this ain't got nothing to do with Joe Biden. Okay. Just get that out of your hair now. This ain't Joe Biden's fault. Everything was implemented. Everything has to be, to be able to meet the needs and the standards, what was going on during the COVID season. You know what I'm saying? So right here, don't let this title, just the title alone, deter you. You know what I'm saying? So just listen to what I got to say. Do your research. Even call down to your offices. And this is not just for Michigan. This may be for other states. So you go into your state and see what's going on if you have the state medical coverage. You know what I'm saying? So here we go. So this was published the 15th. So that was yesterday, 2023 at 2:00 p.m. Lansing, Michigan federal pandemic health protections are expiring, meaning Medicaid coverage would not automatically renew for all users. Some will need to reapply. I don't know why they said some, not all. I don't know why. Maybe it's because of the date they signed up. You know what I'm saying? So they don't have to apply, shit like that. So here we go. Medicaid beneficiaries will have to renew their coverage starting in June, as Michigan resumes Medicaid eligibility determinations to comply with federal legislation. Excuse me. During the federal COVID-19 public health emergency, Congress enacted the Family First Coronavirus Response Act that required state Medicaid agency continue health care coverage for all medical assistance programs, even if someone eligibility changed just because of the pandemic. You know what I'm saying? So they was given, this act was Congress enacted the Families First Coronavirus Response Act. It's all in the title. It was for the coronavirus pandemic, because people was having health issues, people was getting sick, so they obviously needed to go to the they needed to go to the hospital and go to the doctors and all that. So basically, what I'm getting to my understanding, because I have yet to read the bill, but just from the title, I'm just taking bits and pieces, and you know what I'm saying. I might be close, I might be right on target, or a mile off, but it just basically sounds like everybody in the state of Michigan um, was it's not a privilege, was given the right to have Medicaid. You know what I'm saying? It don't matter what type of Medicaid it was, you know what I'm saying, because they have different types of Medicaid, like Blue Cross Blue Shield, but it has a limitation. United Health, shit like that. So they had to go to the hospital. So, you know what I'm saying, give them the health insurance, and then they got money for patients coming in that had the COVID or whatever, or was going through the shit. So, yeah. Anyway. So in June 2023, they will have to renew their coverage. So during the enacted, Michigan Medicaid caseload grew by more than 700,000 people during the public health emergency. The requirement was ended by Federal Consolidation Appropriations Act of 2023, signed December 29th, 2022. So if you want to know what that is, the requirement has ended by the Federal Consolidated Appropriation Act of 2023, signed. So just look that up. Michiganders who no longer qualify for Medicaid would receive an additional information about the affordable health coverage options including on healthcare.gov. Affected Michiganders will be able to shop for and enroll to comprehensive health care insurance as they transition from Medicaid, and many Michiganders can purchase a plan for less than $10 per month. That's $120 a month. So instead of just one less bag of weed, I guess, $10 less off of a bag of weed, $10 less off of fast food, $10 less off of let me see, blunt wraps, $10 less off of coffee, $10. Basically, I'm saying it's possible. The renewal traditional Medicaid and Health Michigan plan will take place monthly starting in June 2023 and run through May 2024. Monthly renewal notices will be sent 3 months prior to the beneficiaries' renewal dates, starting with June. Renewal dates. Starting with June renewal dates, beneficiaries can check their renewal month at michigan.gov/Michigan Bridges. So, it's a lot of stuff on here. I'm almost done. I'm trying to make this quick. MDHHS is strongly recommended that insurers eligible for Medicaid coverage remain enrolled, said Elizabeth Hartel, Michigan Department of Health and Human Service Director. More than 3 million Michiganders, including 1 million healthy Michigan enrollees, have benefited from the Medicaid coverage without redetermination on their eligibility during the COVID-19 pandemic. So here's what the Michigan Medicaid beneficiaries need to do to prepare. So this basically saying this is the information, all the shit you need, your receipts, your copies, all of this. So this makes the transition go a lot smoother than what's going on. So they're giving you the time to get all this paperwork together. So if you can get one piece a day until June 2023, it is very, very possible. I know you have busy lives, but just a couple seconds. So if you're going to take a poop, and it's something that I'm about to tell you that you need, and we all know we go in the bathroom, be on the phone for fucking forever. You can get these documents in order. But anyway, here is what Michigan Medicaid beneficiaries need to do to prepare. Make sure your address, phone number, email address are up to date at michigan.gov/Michigan Bridges. You can also call your local MDHHS office if you do not have an online account for Michigan Bridges to access Medicaid case to or report changes. Visit www.michigan.gov/bridges to sign up for an account. You can also locate organizations that can help you by searching for community partners. So if you don't know how to fill the shit out and you want to make sure you fill it out correctly, and basically, um, or just put in community partners in Michigan and in your county, city, and your county. You know what I'm saying? And then report any changes in your household income. You can report changes at michigan.gov/bridges or call your local MDHH office. I don't want to hear about going up to the building. I know I've had my stints with food stamps and getting health care through the state a couple of times during my lifetime. Okay, so it is a hassle. So if you know you're not going to get nowhere with them, just do the shit online, mail the shit in. Make sure you do, make sure you have your physical copy and screenshots and all this shit. Send the shit to your email. You know what I'm saying? And put those emails like healthcare. Just name it healthcare, food stamps, or whatever the fuck you want. So you know what folder you looking in. You're not just going through a million fucking emails to find it. You feel what I'm saying? So yeah. So y'all go ahead, get that shit done. And if you do lose health coverage, I know it sucks, but you either have to find you a job that does provide health insurance, because most of the jobs I done had, and I done had a lot of jobs, they always offered health insurance. That means my health insurance, vision, dental, vacation time, all that shit. So if you're kicked off the enrollment and you can't get back on, you're just gonna have to find a job that offers it, and they just take it out your check. Because I don't know why people have a problem. I mean, I'm not gonna lie, because I'm just starting to pay health insurance on my own. You feel what I'm saying? My dental plan and all that shit on my own. You know what I mean? It's not the responsibility of my job. You know what I'm saying? Because my job just automatically do it. Like, yeah, I want it. So I work so many hours. They take it out my check, and I ain't gotta never worry about it. So yeah, so that's maintaining that. Do some shopping, look around, ask questions. What do they cover? What don't they cover? You know what I'm saying? Emergency shit like that. So yeah. So I know this shit sucks, but this health coverage, if you wasn't really qualified before the pandemic hit, you weren't gonna get it. You know what I'm saying? So yeah. So go ahead if you can. If you know you're gonna qualify for the shit, get your shit together, because that will help and to make it a less of a headache. Because shit like this is gonna be a headache, because it's not just you. I understand that, but it's gonna be millions, thousands of people that has to re-register in June, August, and all that shit until they can get a good system flow going. So try to stretch your patience a little bit, but it will help a lot if you can just get the shit ready beforehand. You know what I mean? So there's your receipts. Until next time.